This is Danny Bobrow, President of AIM Dental Marketing, welcoming you to this installment of the Practice Perfection Web-Based Education Series. Today's presentation is titled, Lost in the Ozone? Not Anymore. Owing to a health issue, Bill Dome's ability to speak has been affected. Fortunately, Bill's colleague and friend, Dave Hamill, DDS, will be stepping up to deliver along with Bill. Dave is past president of the Kansas Academy of General Dentistry and the Kansas Dental Association. He also served on the American Dental Association's Council on Dental Benefit Programs. He has been a student for continually improving patient care through integration of new technology and behavioral sciences. We're getting some feedback, and I'm going to just take a moment to see if I can address that. So please indulge me.
Here.
Okay, sorry about that. Dave has been a student for continually improving patient care through integration of new technology and behavioral sciences. Collaboration with patients about their health care continues to be an important focus within his practice. Dave practiced dentistry for 42 years in rural Kansas in a small town known for its association with the Pony Express Trail, Marysville. He began learning from Bill through a few internet groups that were formed during his career, which led him to incorporate Ozone into his practice. Bill Dome's expertise runs the gamut and includes aesthetic, restorative, headache TMD, fresh breath, anesthesia and sedation dentistry, sleep apnea, implantology, underlying biochemistry analysis, and minimally invasive services with special emphasis on the many uses of ozone. Bill is a fellow founder and executive committee member, along with yours truly, of the American Academy for Oral Systemic Health and host of the website Zero Tolerance for Bleeding Gums. He founded the International Association of Ozone and Healthcare and is its past president. I'm absolutely delighted to have these two professionals speaking today on this important and vital topic. Attendance at today's event entitles you to apply to receive 1.5 hours of PACE-approved continuing education credit. Shortly following the presentation, you will receive information on how to apply to receive your CE. To be eligible, you will need to successfully complete a brief quiz, as well as note the following course number, which is HAM 102623. Again, that's HAM 102623. For those of you who are logged in and are checking the chat window, I have also sent that via chat to you. And now it is my distinct pleasure to welcome back to the Practice Perfection stage Dr. Bill Dome, and welcome for the first time Dr. Dave Hamill. Hello, gentlemen.
Hi, Danny.
Hello, Danny. Well,
hello, and thank you both for being here.
Well, it's my pleasure to be part of this, and I hope it will help all the attendees know more about the basics of ozone and its uses, particularly in dentistry. What you can expect for the next hour is to see an introduction to ozone, and hopefully it will pique your interest to learn more. There are meetings and lectures out there for deep dives into the science of how ozone interacts with the body through reactive oxygen species and lipid oxygen products, and how ozone even affects gene transcription across nuclei membrane. We won't go that deep. Tonight, you'll get an overview of the many things important to understanding ozone and how it can and might be used. It's been my pleasure, and I want to thank Bill because he got me involved using ozone in my practice and now at home, and I still use it daily. But he's been a friend for many years, and this is Bill at work and doing his thing. He's a mentor and a friend, and an international teacher. And here's Bill and I actually helping with an in-office training for a new dentist that is implementing ozone into his practice. You've already heard a little bit about me. So let's get into ozone, and what is it very basically? It's simply made out of oxygen. You get a little excitement, electrical excitement in that oxygen, it splits and it'll combine and it'll become a triatomic molecule that we know as O3 or ozone. And I want to tell you why I wanted to learn more about using ozone, because I went to one of Bill's introductory lectures. And I think it's a reason you might want to as well, because my concern was about cross-contamination between patients. And this is just a sample of water lines. And this is the type of biofilm they get inside of them, even when we do our normal types of disinfecting. And he showed this slide where it showed how that biofilm is broken down by really relatively low concentrations of ozone. And that intrigued me, along with these types of slides in which this is an 8-chair clinic, and I think this information comes from Dr. Dennis Mahalka, but it shows an 8-chair clinic with multiple portals being tested through lab counts of CFUs, colony forming units. And if you're aware, most municipalities have a minimum or a maximum amount of 500 or less than 500, I should really say, as an adequate or a safe dosage of these colony forming units in its municipal supply as far as the sample size. Well, these portals, they might be a 3-way syringe, they might be a handpiece hose, anything like that. And you can see that in 4 of 17, they tested several portals and 60% of them failed to reach that maximum safe dosage or safe level of CFUs. And so 6 months later or 7 months later, they tested the same office again. And when I say test, they're not using the litmus paper test that we many times used when I was just doing it with regular disinfecting. They actually sent them off to a lab and had the colony forms counted. And you can see that it really just got worse. 93% of those portals had failed, and obviously they had added more portals from which they took samples. So then this office began using ozone in their water supply. Typically they'll put it in those self-contained water bottles that we have on our dental units. And after 6 months, or at the 6-month testing, you can see 100% of those sites passed the test levels, and dramatically you can see that most of them are 0 or very close to 0. Now there's one outlier here, as you can see over on the far right, is a 84,000 count. And so it might interest you to know that that actually turned out to be the water cooler that was in the reception area. So now that you see those kinds of improvements, you also have to wonder, well, how long do they last? Well, here's another office that had been using ozone over a period of about 6 years, and you can see that the CFU counts remain low over those 6 years. There really is no resistance that gets built up, and those biofilms continue to be broken down and to very, very low levels, if any level at all. So
this is just so I'm clear, that's assuming what, a regular flushing of the lines or use of the, what is it responsible for maintaining that low level of CFUs?
That's using it every day, typically in your dental units. Okay.
I see. Yep.
Can I clarify?
Go ahead, Bill.
This is Dennis Mahalka speaking. I'm the one that prepared those slides.
I couldn't hear you there, but basically, you use a low concentration all the time. Usually we put ozone water in with the regular water in the morning and afternoon after lunch, and that's it.
Correct.
Thank you, Bill.
Okay. So obviously I started saying, well, how do you get ozone? Well, obviously you can't buy it necessarily. You have to make it. And this is what an ozone generator looks like. And there are several out there. This is the one I was taught on. But there are several. Dr. Mahalka likes another brand, and they work fantastic. It's simply oxygen goes in and ozone comes out. What happens on the inside is just basically a lightning storm that happens up here in this chamber. I always set up these my ozone generators to the black line coming in is oxygen, and then I have the Teflon line coming out the other side of the chamber because it's now ozone, and ozone will break down silicones and rubber and that type of thing. This just allows you to not have a leakage problem within the generator. Okay.
And that's my fault too, there. They might give incredible credits too.
Okay. I wanted to mention the other type of way of creating ozone is through a PEM cell. And this is the water generation. It's essentially where they're passing water through two membranes. One of them acts as an anode, one of them acts as a cathode, but it is a way of creating a much higher volume of water, but it's very low concentration. But I think some testing shows that is still very effective. But it's for like an office that might want to have ozonated water throughout its office. And this is typically what one of them would look like. This happens to be a BioSure unit, but there are others out there that look quite similar, quite frankly. So, but ozone is usable in 3 stages. It's a gas, which is stable for about a minute, and that's what comes out of that generator. You can also bubble ozone gas through water, creating the ozonated water, and it's stable for a few hours. And the cooler you get it, the more concentrated and the longer it does remain stable. And then you can ozone gas bubble through oils, just creating ozonoids and ozonides. But it's stable for years when it's kept at room temperature or cooler. We'll get to all of that. But the thing I found out was that ozone really is the most powerful sterilizing agent. I guess you could call it disinfecting agent, but there are actually ozone sterilizers out there. They're just big and quite expensive. But it will kill bacteria, it'll kill viruses, fungi, protozoans, prions. And the beauty of it is that it really has minimal toxicity to human cells. And this was another slide that I remember from Bill's first presentation, and this is ozone versus bacteria. Of course, bacteria are going to be responding to antibiotics generally, but you can see some of the more broad spectrum antibiotics, clindamycin, ampicillin, and they all have their weak spots versus certain bacteria forms. Whereas ozone, clear over on the right, has a very, very strong effect against every single one of those bacteria. So how does it work
Dave,
against?
Quick question
Yes.
before you go into, are there any bacteria against which ozone has been demonstrated to not be effective?
Well, to my knowledge, no. Bill?
No, there are not. They just don't live long enough to become resistant, period.
Sure. So
Okay.
that kind of leads us into how and why does ozone work against really any microbe?
Mhm.
And very simply, it just dissolves their membrane. It works against the polysaccharide membranes that make up these simple cell walls for bacteria, viruses, fungi, it goes in and breaks up the double bonds. It kind of dissolves it, it explodes it, or whatever you would like to call that. But that's how it affects microbes of any nature. Okay. This happens to be a photomicrograph of a bacterial membrane being ruptured by ozone. And you can see some of this research has been done 20 years ago. So, and here's a way when you're trying to use ozone in the dental practice, you want to make sure you use an active ozone. And here's a way of testing that, because your gloves, which are latex or nitrile, are also polysaccharides. Nitrile may be a little more resistant, but you test it against that, you notice that you're getting instant disruption and ulceration of the latex glove. And from there, you can take that ozone and go directly to the lesion, prep, whatever it is that you're going to do as far as treatment. So, but at least this way, you know you've got active ozone. And I'll show you an example of that later on in the presentation. And so since it's the most powerful sterilizing agent against all of these things, the next obvious question is, why doesn't ozone kill me? And the simple answer is we have complex cells walls which contain antioxidants. However, not so much in our lungs or eyes. Obviously, our lungs, we're trying to pass oxygen. So, and some research through different bodies show that ozone is actually produced in our own antibodies and white cells during bacterial killing and inflammation, but it's also removed by normal enzymes. And it's broken down just by the enzymes that we have that you've all probably heard about, catalase and glutathiones and SOD. And this was the interesting slide that came out of a manuscript that I saw somewhere. But it shows the metabolic activity of human cells exposed to ozone and other antimicrobials. And you look down here under the cell viability assay, and here's your control group. And you can look at the level of viability of the human cells when exposed to ozone. And then you start to see how caustic some of these others can be. Sodium hypochlorite is commonly used in dentistry. But for ozone, it's very, very small change. And this is just a summary of several different papers. I tried to highlight some of them that just by time-wise, you're going to only get a chance to really read the headings on it, but it's talking about antibodies killed by producing ozone. Ozone production and amino acids contribute to killing of bacteria. So what we're basically trying to do, and what we're saying, is that we are really supporting what the body does naturally. And but that's not to say that there's not safety issues that you need to deal with, because ozone is it's a toxic gas. However,
Dave, excuse me 1 second.
Yeah.
I just noticed that the size of your screen seemed to decrease a few levels. I'm not sure if you can restore it. I mean, it's still viewable,
It's okay
but it's
here,
got.
Danny.
Is it?
Yeah.
Okay. All right. Thank you. Then it might be at my end. Never mind.
Okay. Well, we have a couple safety, I'm going to say, outlets in our body, and also one from the system that we have in dentistry. And the first safety net is the fact that ozone really comes from the Greek word ozine, which means to smell. And so we can smell ozone at very early levels and early stages. But you do need to know that exposure to ozone gas can become fatal if you can stand being around 100 parts per million for 15 minutes, which I know you can't. and I don't know of any generator that we have that in dentistry that would produce 10,000 parts per million. But and there are exposure workplace standards. A person could be exposed to just ambient air ozone for 8 hours at 0.75. So the common sense is you really want to avoid breathing ozone or putting it directly in your eyes. Okay, but the body can tolerate it at low levels, and we can also detect it at very low levels. And this just shows that there's about 1% of the 15-minute exposure level, according to OSHA, that the human nose can detect. So you're going to detect it with that safety measure built into your body well before it gets to any type of mortality level. So just pay attention. But excess gas can be toxic if inhaled over time, especially if made from air, because there's a lot of nitrogen in the air. And in dentistry and in medical settings, we use oxygen. So you avoid all of those nitric type of toxins too. So the other safety net we have really within our system of dentistry is, you notice that the inhalation risk of dental procedures are being used during dental procedures. If you use a suction nearby, it reduced the ozone level to 0. And even when you had the vacuum in the mouth, it reduced it to near that. So it's very, very low. And of course, you're not using it for any really long periods of time. So you definitely want to use suction, but I don't know of a dental office that doesn't have a vacuum system chairside. So, but you want to use it.
Let me break in for 1 second. In South America, they don't have high volume evacuators. All they use is regular saliva ejectors, and they work fine.
Mm-hmm. Yeah, I would agree with that, Bill. Typically, when you're using ozone, I think we generated it at 1/32 liter per minute. And of course, even a saliva ejector is vacuuming at much higher rates than that. So, yeah. But let's compare this, because in Germany, they did a study where 644 physicians used ozone treatment millions of times on 385,000 patients. And most of that was systemic treatments. And they reported 40 minor reactions, most of them rash type reactions. I think Herxheimer type reactions would be the norm of most of those. And then you got to kind of compare that to what kind of mortality we have from prescription drugs. And I think this is a FDA report from, I'm going to say circa about 2010, that said 140,000 deaths from prescription drugs in 1 year. So comparative wise, ozone can be handled and it can be very, very safe. But you don't want to do dumb stuff. Don't do dumb stuff. And there was I guess it's still in print, but there is a textbook, I think, on ozone in dentistry by Eddie Lynch, and I think Eddie has passed, if I'm correct.
But Eddie's still going. It's Julian Holmes that passed away.
Oh, okay. Julian is the one that passed. Okay. But anyway, Eddie is a pioneer, and really so is Julian. And
Julian was a former guest presenter on this platform, and anybody interested can go to the archives and look for that as well. It was an honor hosting Dr. Holmes.
Good. Well, you can certainly use ozone for more than just surface disinfecting and water lines. You can use it in all areas of dental care. I know that in my practice, we were a very rural practice, and we did a a good amount of orthodontics, just general orthodontics. And for those dentists that are on this webinar, I think if you do that, you'll also notice that sometimes kids don't brush their teeth, particularly around brackets. And so we just devised a way of, even in orthodontics, where we would use it as a preventive measure to help kids avoid having all those white decalcifications around their brackets. And it would be something the assistants could use and apply and help the kids maintain the health of their teeth for that. But here's a caries treatment where we've had you can see this is a pediatric molar that has broken open, and it looks like they might have taken out any goopy type of caries, and then they'll just treat it with ozone, and maybe they put something like Capasol on it, or maybe they just let the saliva remineralize. But it will have a tendency and propensity to remineralize after you kill bacteria that are down into the dentinal tubules that are even at a low level of carious development. So
we have never seen one of those remineralized lesions ever decay again.
It was very successful in my practice with this type of thing too. When you weren't really concerned about having to restore the entire tooth, but you wanted to maintain the tooth for sure, you could let it do that. You can maintain prosthetics with ozonated oils or water. Just tissue stays a lot healthier around it. And you'll see more and more of this probably nowadays, because we're getting into far more sophisticated implants and prosthetics than we used to have. Desensitization, boy, hygienists love this. I know that when I went into a practice, one of the things I asked them to do was bring in a hygiene patient that had really sensitive teeth, and these were usually upper molars, and we would just simply draw up some ozone gas and in a 6 milliliter syringe and ozonate the root surfaces. And when you'd ask the patient what it was like compared to what it was usually like, they would say, oh my gosh, it was so much better. Maybe gone from an 8 to a 3 or something like that. But they were far more comfortable, and it really is almost instantaneous when that happens for them. So, but this just is showing an applicator putting the ozone on the teeth, and they're obviously you got the vacuum right handy too. So I'm just showing a little how you can infuse into a pocket with a cannula on an applicator tip. Again, there's your vacuum right next to it. But in perio, you can irrigate with ozonated water. You can ozone gas a pocket. You can apply ozone oils in a pocket. You can send ozone oil home with patients and let them use that on toothpicks or rubber tips, or we like these TPs, or maybe people are more familiar with proxa brushes, but all those types of ways you can apply it. Other uses, really about any lesion, whether it be canker sores, abscesses, trauma, sutures, herpetic. A lot of times this is kind of a rule of thumb. You can just ozone gas them for a minute and then follow it up with some ozonated oil and take home some ozonated oil. And this was an interesting slide I remember from the first meeting I ever attended, and it over here on the left you see several different studies that are really talking about airborne pathogens and the effectiveness of ozone against them. And at the bottom, I think this is the one where they draw this chart from, but it's a school system where they just simply recorded what kind of sicknesses were being experienced by students, and they had untreated air for a certain period of time, and you can just see the number of tonsillitis, sore throats, etc. down the list. And then this school system started ozonating their air at the source, at the HVAC systems. And you can see the dramatic drop. And kind of the interesting thing was that it even reduced toothaches. Now, I don't know the correlation to that, quite frankly, but the fact that
I
it's one
suspect that was sinusitis, Dave. I suspect sinusitis there.
Okay. Yeah, that could be, as opposed to actual decay or something like that. But
Right.
yeah, for sure. But a pretty dramatic. Well, I don't care whether you call that a correlation or a cause and effect, but when you have that many correlations, it makes you take notice. So, in summary, it's great for killing and altering bugs and biofilm. It does stimulate the body's immune system. We'll talk more about that later, but it's not a magic wand, but it's another great tool. And I would encourage you to take courses, learn more. But we do want to work to prevent these types of things, which obviously these are infections, but I'd be willing to bet that there's probably some behavioral aspects to these kinds of problems because the age of the child and maybe their unwillingness to have routine type treatments on them. But before they get to this point, you do see a lot of this. And in my practice, I did see a number of it. I was, again, a general practice in a rural town. And if you're just wanting to maintain these, and if these are not, abscess to the point where they show and are truly abscess teeth, you might want to try something different. And so here's what we would do. Now, this, you might, first of all, take notice, where's the aspirate or where is the vacuum? It's up here. But this is part of the behavioral side of things in which the child is in mom's lap. And what mom is doing is simply practicing and having the child feel what having this applicator is like being put up against their teeth. And so once they're comfortable with that, now you can get to work. Now you can hook up the ozone hose and start putting ozone on those teeth, and now your vacuum goes to work. And you can actually use that as far as a treatment for prevention of further development of those areas of decay. And you can end up
for 1 sec, Dave.
There's
no pain whatsoever applying ozone to the tooth. If anything, it desensitizes it. The scary part for a kid is probably the noise of the big vacuum. So most of the time for kids, we'll use a saliva ejector right next to the tooth rather than the high volume.
Oh yeah, that's a good point. Yeah, but you do end up with this. It's like you say, the kids had a good experience, so now what you're doing is even helping that child have an experience that really makes their visits more pleasurable, and they're more willing to become patients and be taken care of in the future. So, and this is something that really hit home to me. This doesn't happen to be one of my particular cases, but as a general dentist in a small town, I saw this a lot. And this is the typical 7 or 8 year old that mom and dad brings him in, and he's got a 6-year-old molar or 6-year molar that's in and nearly bombed out. You know that it's got an exposure. And so at one time in my practice, I would be telling the parent that, it's going to need to have endo, but the problem is that the roots aren't fully formed and et cetera. We're going to have to go through these stages, but we're going to end up having to do endo, and then eventually whatever, it's going to be crowned. And of course, mom and dad are going, well, we can't afford that. Let's just take out the tooth. Well, ozone gave me a whole new look on this, because what I would do now is simply what it shows here is you would go in and take just a spoon or something and just kind of scoop out the goop, the real soft carious areas. And then you would basically go to something like this and you would just ozonate that. And then in my practice, I use something like Capasol or something, and then I would cover it with a restoration. This is some type of Fuji ionomer or glass ionomer, heavy body restoration material. And then there again, I'm going to say in my practice, 99% of those would be without anesthesia. And I'm not going to say never, but at the same time, it really changed how I approached things with those kids. And typically then what you would do is you'd have a tooth that was saved. It allowed the dentition to develop. And of course, the kid had a much, much better experience. I'm just showing you how you would apply it. You're insufflating the caries. You've got an applicator. It's got a silicone flexible cone around the tip that you can make out of silicone tubing, just cut in pieces. And you just put it over there for a minute, for 40 seconds, however long the kid will let you sometimes, but try to keep it there for 45 seconds or 60 seconds. And again, there's your vacuum right next to it. And this is an interesting case, and I wanted to show it. It's a friend of ours, Dr. Malterud, shows this case because this gave me a new outlook on adult deep caries lesions. You can see what's going on here. You look at that and you're saying, well, that's a probable exposure. You're seeing some not so cleansable dentistry, and I can assure you that Dr. Malterud didn't do that. But here it is. He cleaned it out, and sure enough, there's your exposure. Well, at one time I was taught that if I had an exposure on an adult, that meant endo. That meant a root canal treatment and buildups and everything else. Well, when I started using ozone, I started treating these differently because I would go in and ozonate those and then put something over them, like Theracal or something like that, and then you can restore over them. And that's really what Mark teaches and does. And of course, you can see here this is a media post-op picture and radiograph. And you can see some very nice cleansable restorations. But he's also was able to follow this case for 5 years. And this tooth over here still tests vital after 5 years. So the protocol, basically you treat pulp exposures like soft tissue infections. If you can get good healthy bleeding and let it stop, and then you hit it with gas, ozone gas. Again, you're going to do it for a minute, 45 seconds to a minute. Then you can place something like Capasol and Theracal and a glass ionomer base or a glass ionomer restoration for an interim, but then you can just restore over it, because one thing that we did find is that ozone does not interfere with bonding. In fact, there's maybe a hint that it actually increases bonding, but it doesn't interfere with it. And I put this in to just show that it does look to me like there's some remineralization going on the case like this, where this is a pretty obvious exposure on the left. And yet on the right, you can see that after ozone treatment, and again, it looks like they put in an interim type filling at this point. But I think through here, I think you can see, or at least that looks to me like there's been a good bridge of remineralization going on there. So, and honestly, at this particular case, I don't know whether they completely uncovered all of the exposure or whether they left some in there. It maybe looks like they left some of the carious dentin, deep carious dentin in there, and that's probably what's being remineralized. So.
Dave, let me mention though, if you see where that arrow is pointing on the right-hand portion, you see some dark material there. That is the part of the tooth that was carious that did not remineralize.
Okay.
So after they sit for around 3 months, then you can excavate that out and get great bonding on top of the remineralized section.
Sure, that makes sense. It also makes sense why maybe they put an interim restoration in there during these 3 or 4 months. So, well, how does ozone work on caries? Well, I think most everybody knows it's really our body's reaction with MMPs, I think, that causes caries, but they're triggered by a lot of acidity. And so you look at an NMR spectrum of root caries anyway, and it just shows that there are most of these lines are quite graphic increases in acidity. And when you look at a sample, you can see the before ozone, and this is the NMR before ozone, lots and lots of vertical lines. And here's what it looks like after ozone, and you can see really most of those are completely neutralized. And of course, that shuts off our MMP reactions to further the caries, advance the caries. So that's the basics of how it affects caries and why it's affected that way. So, and I hope that shows up well enough. I really couldn't get that lower graph to show up any better. I couldn't change the color on it.
Looks good to me.
Okay. But you also need to keep in mind that ozone isn't going to do everything. You still have to control habits and manage salivary issues. So I'm just going to show you a few ways that you apply it. This happens to be, again, using that silicone tip. It happens to be on a very fancy handpiece that I don't think they even sell that handpiece anymore. And there's certainly no need for it. But that was some of the earliest work I think was done with a Cavo unit, and I think that might be a handpiece from that.
This one was made by Fadi Sabah in Beirut.
Oh, okay.
But as you say, there's no need for something as fancy as this.
Yeah. Yeah, insufflation of a pocket. I showed you this picture a little earlier, but again, it just put a cannula. You get these things. I'm sure if you do endo in your practice, you've got those around. You just put them in a lure lock connector, and you can run gas or water down into a pocket. So that's how I would insufflate a pocket. There's also tray applications. One of my best friends had to have radiation therapy when he was younger of his neck. And it was the old time radiation. And so he really struggled with salivary issues his whole life. And we made trays for him. And that was part of his hygiene program. Now, these are real fancy trays and probably overkill on the inlets and the outlets. But that happens to be one way of doing it. This is how we did it in our practice. We would just use silicone putty, and we would have a line going in for ozone and a line coming out for vacuum on the other side, and then we'd even supplement the vacuum just to make sure none went down the pharynx. But we helped. In fact, he's still got really most all of his teeth after 30 years. So as far as ozonated water, I show you this. This does happen to be in my old office. Here's our ozone generator up above, and our oxygen supply, which nowadays we have a much bigger bottle for that. And then we would just ozonate the oxygen. It would come down and would go into our reservoir of water down here. And I would do this early in the morning when I got to my office. Then we would take water out of the reservoir and we would put it in our self-contained water bottles that go on our dental units. And we would do this in the morning, and then we would do it over lunch hour. We would ozonate a big batch of water again and replenish those ozonated water in those water bottles on our units. So, but I did mention, I think earlier, that if you cool the water, it does last longer. You even get a little stronger. So that's why we had ours run down into, I think this was some kind of a drink cooler. It didn't have a freezer in it, but okay. You can put ozonated water in a heated irrigator, but just the opposite applies. If you're heating the water, it's gonna lose its ozonation much quicker. So this would be something that somebody might want to do on a personal level, or if you're going to do it in an office, you're going to add the water right before you use it for a patient. And you can put ozonated water in those reservoirs on your ultrasonic scalers for your hygiene too. So a hygiene visit, and this kind of reminded me, I wanted to mention this. We used a lot of pre-rinses, and because if you think about the amount of aerosol that's generated in, well, hygiene or any dental procedure, I'm going to want to minimize how many airborne pathogens there are that could affect me or my team or anything like that. So I always felt that this was a greater safety factor for all the team. But as far as healing and helping the patient, you can also use the water in your ultrasonic scaler. You can dip your hand scalers in ozonated oil. You can gas pockets that are deemed deep or problematic, and of course you can even send some oil place some oil in office, or you can send some ozone oil home with a patient where they can apply it with a rubber tip. We did use ozonated ice a lot of times for post-surgical, like for extractions, or if we're going to do a bone graft or something like that. Because what you can do is you can just take some ozonated water, pour a little, I'm going to say, get a sliver of it in a baggie and then put that in your freezer. And so what happens is you have a bottom layer in a baggie that's something that the patient can take home, and they can keep it frozen, and they can break off a little chunk of that ice and put it and have it melt in their mouth, and just helps maintain, just act as a preventive rinse for keeping infections down, and it will help with healing as well. And of course, you remember that it's breaking up double bonds, so it's going to help your breath smell better, and because it's going to minimize those odor molecules. Okay. Well, we get into how does ozone really kickstart healing. We just briefly mentioned that, and there are a lot of underlying mechanisms, and again, this is where you can get into really deep dive into science, and I'm not going to go there. I'm just going to give you some overview of it. But it does activate cellular metabolism, and there are some papers on that. It increases your cellular energy through increases production of ATP, which everybody knows is what our cells use for energy. It increases cytokines to help wound healing. Ozonated water, it just shows accelerated wound healing. It helps make new collagen, and it helps the body make new stem cells. The other thing it does is it makes nitric oxide, which I think most people understand. It helps relax smooth muscles of the blood vessels, and it releases the prostaglandins, so it improves circulation. It allows the red blood cells to have an easier roadway or easier pathway to be transported. Okay. And a couple of things that go on with the RBCs themselves, just to give a kind of a slang description, it basically allows the red blood cell to carry a little more oxygen, and it also allows it to release oxygen more readily. So I think we give it the name of a super gifted erythrocyte for those two qualities that it does and how it affects red blood cells. So we can say ozone brings oxygen to healing tissues. It does enhance phagocytosis. I think I'll show you a slide or a little video later that might give you an idea of that. It accelerates the epithelial migration and it increases collagen synthesis. And these are a couple of the doctors that have studied all of that. Plus a ton of other stuff. And that's where you can go in and find out a lot more about reactive oxygen species and lipid oxygen products and gene transcription and everything at an intracellular level. So a lot goes on. I wanted to touch base on ozonated oils because they are an alternate. They are a safe alternate to ozone gas. They're a lower strength, and I think I've read an article or two that indicate that they're about 50%, 60% strength as gas. They're kind of like a long-term release or a slow release of ozone in a way. You can make those on your own or you can purchase them. And but they do become ozonides. And you can even breathe the ozonide vapors if you would like. Where do you use ozonated oil? About everywhere. Endo, if you're doing multi-visits, you can do denture sore mouth and angular cheitis, periodontal disease, big time. The surgery, we used it in surgery quite a bit, post-extraction. When we placed implants, we would place it on the implant or on the site we were going into. You can also even try and treat failing implants, and it might give you a different modality, particularly when you have these long span bridges. So, and here's Dr. Dome actually training, because training is important. He was, I'm guessing that this was at his teaching facility, and he probably had several dental offices in there, and he's teaching. We also go into dental offices and help train and actually implement. And when you do something like that, you want to be able to, when Bill and I leave, it's your practice is up and going. And it you know, we're there for support and answer questions, but we don't want to be leaving and having you say, well, what do I do? You know, we want you to know what to do. And so part of it is patient treatments while we're there. So, Dr. Eric Zaremski is another dentist that knows a lot, and he teaches and trains. There are other dentists in the area, or in the United States, I think, that get out. But the key is you do want to involve your team. And here over on the far right is Chris Duvall. She's a hygienist who has worked with ozone for many years in her practice. And I think that's in the Seattle, Tacoma area. But she helps train, and she's very much a believer in team training, and really helps your team develop both the knowledge and the culture to really take your practice to that level where you're implementing it every day, because it is a team-oriented and culture-oriented application. This just happens to be a little bit of what goes on in a team training. They're working, I think, maybe making trays or something like that. Yeah, this shows it making a tray. That is, like Bill said, is a little overkill with the vacuum, something like that. But you don't have to have the external and the internal. And I wanted to show some examples of its use. I mentioned salvaging implants a little earlier. And this just shows one case where you've got probably a massive, maybe a full arch prosthetics that has subperiosteal connected to endosteal, and now you've got this bony void and lesion. And so rather than completely sacrificing it, you might want to try something. Well, this is a little bit more of a close-up after they've tried something, which is including using ozone around those and probably ozonated oil. But it gives you one other modality. And this just is a kind of a before and after, but to me, it looks like there's some improvement there. And I would certainly risk getting this kind of result rather than starting to cut away at a long span prosthetics. So you can accelerate bleaching with ozone, and it does one thing really well, is it does desensitize. So some of the offices that do a lot of bleaching might know this more than any about the sensitivity of teeth, but ozone does desensitize, so it does help minimize that. Here's a case where a little papilloma shows up, and so what they did was they probably made a tray that fit over about 6 or 8 teeth. And you can see that there appears to me to be some improvement or some good improvement. And this was just 2 visits at 2 minutes of O3 or ozone application. So perio, this was a big interest for me. And I think everybody by now recognizes the correlation and connection between cardiovascular disease and periodontal disease. Even the American Heart Association was saying things back in 2013 about that. And I think very recently, they've found that as many as half of all heart attacks are being triggered by oral bacteria. And oral pathogens were found in every thrombus, and 30% have live oral pathogens in the clot. So really at this day and age, there's no doubt there's a connection. And I found this article just recently, and it interested me because it was talking about subgingival application of ozonated oil. And it came from Tanta University in Egypt, but the results showed improvement in all clinical parameters, which was maintained for up to 6 months when they used ozonated oil in addition to the normal procedures. And then you go down to here, it says, whereas scaling and root planing alone resulted in a significant improvement only up to 1 month. Well, to me, that's like putting more arrows in my patient's quiver. I would rather them have 6 months than 1 month improvement based upon what I do. So there's just a lot that can be done out there with ozone. And if you've not looked through a phase microscope, this is typically what perio microbe biofilm looks like, I guess. A lot of motility, lots of spirochetes. So now we're gonna put a little gas in there and take a sample, and you can still see some motility, but it is so much more minimal. So, and I could have shown you a lot of slides on this, but time-wise, we just can't do all of that. So, and this was what I was talking about, white blood cell activity. And here on the left, you can see they're moving it around, and you basically got not much going on white blood cell wise. And yet we go over here after we take ozone and induce it or include it. Now you can kind of see the white blood cells are on kind of a seek and destroy mission. At least they're doing their job. They're looking and they're moving and they're looking for particles that they can devour, looking for anything they can do to protect the body. And if you remember right, there were a couple of those articles in that one summary slide that I highlighted some of the titles that did talk about the antibodies actually creating ozone in the process of phagocytosis. So we'll go on. If I can get off this slide. Okay, yeah. I put this in as a reminder also that the dental tubules, they go all the way from the root canal space, the pulp chamber, to the cemental enamel junction. So there is a connection to perio and endo. And so when you get into a case where you're going to do what you maybe at the time think is heroics, you need to be looking at both the endodontic and the periodontal treatment. Now, here's a case where, for whatever reason, they were going to try to keep this canine. They sacrificed the lateral, but they treated both endodontically and periodontally with injections of ozone peripheral to the tissue. In the peripheral tissue, they ozonated the pockets. They placed oils. And between August and March, you can see what looks to me like is a nice improvement. Now, again, I don't know the case. I probably wouldn't be hanging a 6-unit bridge off of that tooth, but at the same time, it looks like it's gotten a lot more stable, and you've certainly been able to salvage the tooth. So when you apply oils, you can use rubber tips. We like these TPs, or I think Proxibrush is real similar. We like the TPs because they not only clean the concavities, but they carry the oil very well up against the roots and below the tissue as well. So, and when we get into the endo part of things, I think most everybody that is in a general practice or an endodontic practice, I don't know who all is attending, we realize that we have got quite a complex system of anatomy within the roots. It's not 4 straight up and down cones and circular cones that are going down these roots, or 3 or 2. And one of the important things to remember is that, ozone does carry a negatively charged area, whereas biofilms and microbes actually, during inflammation, carry a slightly positive charge. So gas is going to be able to go where gas goes, but it's also going to be able to seek out some of these areas of infection and inflammation and microbes and actually affect them. And this is a reminder that half of all teeth with apical lesions had bacteria in tubules all the way to the CEJ. And it looks like this has been known for over 20 years. And another interesting thing to me was that 40% of the particularly endodontic lesions are fungal forms. 40% of the microbes are fungal, which are not going to be affected by antibiotics. So you do have ozone gas, which is way more powerful disinfectant than chlorine, and it's a much greater rapid kill as far as a kill rate going. So why not use something like that? here's an article on ozonated water. It says better disinfectant of tubules with no cytotoxicity to human cells. That was done Journal of Endodontics, and that's almost 20 years old. And I bring this little chart back up because I wanted to point out again, here's the control. We're looking at human cytotoxicity. And we look at across here, the ozone levels, different concentrations, just really very minimal change. And yet you get over to what is very commonly used and look at the cytotoxicity and look what happens to the metabolic activity of the cells after they're exposed to that. And I'm talking about human cells. So, but here's kind of a typical way we would use things. We would inject ozone gas peripheral to a tooth, whether it's an endodontically needed treating tooth or whether it's going to be surgically removed. We would do this quite a bit. You certainly can. It's not an issue. In endo, you'd use ozonated oils or water. We typically use water during treatment. If we had to medicate it for some reason overnight, we would perhaps put a pledget of cotton with ozonated oil on it in the canal and then temporarily cover it. But most of the time, we just kept our ozonated water as our lubricant. And then once we got done with that, here is my successor and partner at the time, probably, that is going to show you how we would test it in our office and how we would use it very quickly. So let's try it. Okay. Going to test it against her glove. Boom. It breaks the glove. So we know we've got active ozone. Now she's going to put the little cannula on it. Directly to the canals, and she's going to let the ozone just percolate up the canals, probably 45 seconds to a minute in each canal, and then just keep on, finish your procedure. Do your gutta percha, sealer, that type of thing. Okay. Okay, but this is what I wanted to point out. When you do it using ozone, you have no risk of bleach necrosis. Do you remember the graph that I showed you about the cytotoxicity and how ozone affects both metabolic activity as opposed to sodium hypochlorite? You don't have this kind of risk when you use ozone in an endodontic procedure. And this is obviously a very significant situation, a case here, and I sure hope this has never happened to any of you out there. But if you do any endo, particularly in a general practice, or any endo of any significance, I'm going to speculate that you've had a patient that you get an endo done on, that everything went beautifully. You take a final film, it looks great. The patient goes home, and as soon as the anesthesia wears off, they call your office and say they're in excruciating pain. And so you are not really sure what's going on. You up their pain medication, and the next morning they call you again. So you have them come back in. You take another x-ray, maybe a different angle, and sure enough, it still looks perfect. You check their occlusion. Oh gosh, it might even be out of occlusion. And you're just really frustrated. Of course, the patient's frustrated too, and they finally say, get the tooth out, doc. I'm gonna guess that instead of something happening as serious as this, that it's possible that some of that sodium hypochlorite got extruded beyond the apex on a very microscopic level, and you just set up a much more minor inflammatory reaction that caused that type of a pain. Now, again, that's my speculation, but I tell you what, it happened to me in practice. And but after I started using ozone, it didn't happen to me. So I do want to address this question: is it legal? And because there's been a little bit of confusion out there, because there's a kind of an ominous type sounding statement in the council or by the FDA that says ozone has no known use in medicine. Well, that's not a regulation. That's just a statement. And so I'm going to go to legal authorities, and here's their position. As we have pointed out many times, the FDA does not regulate the practice of medicine. States have that authority, and that comes from a consortium called the Drug and Device Law Consortium. So, and you go back one, it's not really legal to use. It's not approved. Let's put it this way: Clorox is not approved for dentistry, and yet it's common. Okay. And then most recently, here's within September, 1st of September, a court ruling came out on the authority of the FDA, and it told the FDA to stop practicing medicine. And hence, this is from the ruling. It says the FDA is not a physician. It has the authority to inform, announce, and apprise, but not to endorse, denounce, or advise. And of course, even in the old standard, you see no mention of the word prohibit. You're not prohibited from using ozone. And we can go even a little further than that. We can actually look at see what the Code of Federal Regulations says about it, because it does deal with medical devices. And you have to have an ozone generator. So there are exemptions for the device registrations is what they really mean here, because if you look up here, it's establishment registrations. The Commissioner of the Food and Drug has found that such registration is not necessary for the protection of the public. So who's exempt? Well, licensed practitioners, including physicians, dentists, for use in their practice. So you get physicians that they can bag a hand that's been burnt, and by bagging it, all they're doing is they're putting a plastic bag around it, putting ozone in there to help treat the burn. In veterinarian, you can bag a horse's hoof as well as a physician can bag an appendage, whether it be a hand or a foot. It's used quite a bit in veterinarian, as I understand it. You can insufflate by injection into a joint, whether it be for a TMD type therapy, whether it be for tendonitis, whether it be for arthritis. But you certainly can do that, because you're not putting anything that's going to be cytotoxic into the human tissue. Ear insufflation is another way that you can get some absorption, and you just need a stethoscope type thing. Some of these stethoscopes have little vacuum hooked up to them, or you can just also take a fan and blow it away from the face. So if there's any ambient ozone coming out the ear canals, it just gets blown into the room, and it'll quickly dissipate, and it'll just be reduced back to oxygen. And you have a really highly vascular ear canal. And it's also a very, very thin membrane there. So you can get absorption through that. And then, of course, you do have your very, very close proximity to a vascular plexus. And it just so happens that we do have quite a few of our tonsils, etc., that are just right there on the other side of the ear canal. And this just shows a case where, again, you look at it from a behavioral standpoint. This kid is kind of having fun. It's not something that, from a behavioral standpoint, is hard for patients to endure or to put up with. And again, just have the fan blowing it away from them into the big room. This is another thing that you can use. We use that. I personally use it still to this day. You can just take some ozonated water and put it in the top reservoir. We always diluted it. We didn't need it full strength, and then just put it up to your nostrils, and it flushes one side and vacuums out the other side, and it goes out down into the bottom reservoir. Very nice way to treat and flush sinuses and that type of thing. So, breathing ozonides. I mentioned that you can breathe ozonides. That's just the vapor that comes off of bubbly ozone through an oil, whether it be olive oil or avocado oil. Those are the two common ones that I like to use. But they will do that just to stimulate the immune system, help your overall health. I guess it could be used as a preventive measure too. We actually, whenever I would travel, we would just take a little ozone oil and place it in our outer nostril, and that way we're breathing over that when we're in crowds or things like that. I would just rather have my air passing over something like that than without. Here's probably some of that heavy systemic treatments that's available. Maybe what was some of what was going on with that example of the German physicians. This is extracorporeal ozonation. I think this acts a little bit like a dialysis machine. Is that correct, Bill?
Yeah, it's a dialysis chamber reverse.
Yeah. And there's other ways that they can do something that's similar, where they basically, it's like when you go to a gymnasium and give blood and they take it out and you got a bag of blood, and they can ozonate that blood and put it back in you. And that I think that's called 10 pass, is one of the common processes that they use for that. But it's, as I said, you can see it's pretty easy. They're just watching what is happening. So, and then, oh yeah, here's an example of an ozone hospital sterilizer. It's a big unit. It's an expensive unit, and it's just not something that we really are going to do in dentistry. And here's just a couple of little tidbit type things. These are probably home type therapies when somebody's got ozone oil at home. Here's a patient with psoriasis. Here's after they've been able to use ozone oil for on a regular basis. I think most everybody will agree that seems like an improvement. And fungal onychitis, what it looked like on day one. It usually takes several days on these, because many times that fungus can actually get, I think, under the nail bed. And so it does take a few days before it'll actually really show improvement, I think, sometimes. So, but those are, again, things that people can do at home with them. And I think by now you know that this is kind of a trick question. But which hand had the ozonated oil? You know, obviously it's the patient's right hand that had the ozonated oil, and it just helps speed up healing. There are cases where people get this for skin rejuvenation, and I know Dr. Dome knows this doctor, Dr. Valio, and but that's just where it is helping regenerate collagen. So it does affect the wrinkles that you have as you age. And then last but not least, do not think of ozone as a miracle worker. It is amazing, but it's never going to turn what you have on the left to what is on the right. So kind of in summary, ozone's used in 3 different stages. Gas, you generate it on site and it's active for minutes. Water generated on site and it's active for hours. Oil makes ozonides and you make small amounts or you can buy it and it's active for probably several years if you keep it at room temperature or cooler. So this just kind of shows a typical setup, something very similar to what we had in our dental office. We had carts that had the generator in it that we would use chairside. It's great for killing and altering bugs and biofilm. It does stimulate the body's immune system. It's not a magic wand. Take a course. But you can make your practice more unique. And lastly, I'd like to say thanks to the many people I've hung around with and learned from and used their slides this evening. I've learned from all of these gentlemen and they're all great dentists and friends. I would encourage you to join the free online discussion group. You can simply email Dr. Dom down here. And where do you go to next? Well, there's several different organizations. I'm familiar with Ozone Therapies Group. In fact, they have a ozone meeting in about a week out in Santa Barbara. There's probably only very few openings left for that. But if you've got nothing going on, you can probably still get into it. And the AAOT does have meetings as well. I think those meetings are generally in spring, April, May, somewhere in that area. Dr. Malika's group of integrative medicine and dentistry, and then AOSH, which is Oral and Systemic Health Organization. So I encourage you to think biologic and feel free to stay in touch. I'll give you a minute or so to, if you want to make note of those numbers, you're welcome to contact us.
And let me just jump in and thank Dave for handling this presentation. Obviously, I'm not speaking so well these days, having had some fairly heavy-duty oral surgery. But Dave is really on top of all of this stuff, and both of us are entirely happy to answer questions down the road.
Right. And I want to thank you too, both of you gentlemen, for we ran a little bit late. I let you go because you had so much informative insights to share and really actionable information. People can apply this immediately. I do want to save some time here for some questions. I won't be able to get to everybody's questions, but you're welcome to reach out to these gentlemen directly, and you will be receiving in a few days an email with instructions on how to receive your CE, as well as a link to a recording of this webcast. First question I have for you gentlemen either is, what gamma do you use in the mouth? I hope you understand that question.
Well, I will share with you that the gamma sometimes is used as a full dose. In other words, you're going to give somebody 100 gamma. That may mean the total dose, or that may mean the dose at which you are producing ozone. Essentially, the generator that I showed will produce ozone at 100 micrograms per milliliter. That is 1 part per million. It's 100 gamma. Okay. Mm-hmm. So if you give somebody more than 1 milliliter, then you're giving them 200 gamma. So you just need to be careful on how you refer to gamma. But typically when I'm doing something as far as a procedure, like I'm trying to put ozone on a prep, it's going to be flowing at 100 parts per million, or 100 gamma. I may try to leave it on the prep for 30 seconds, 45 seconds, etc. If I'm going to inject ozone, I'm going to be injecting at maybe 20 to 25 parts per million. Does that, I hope that answers your question. Okay.
Oh, thank you. Yes. Next question. Do you use tap water when creating ozone?
We use distilled water or filtered water. It's been shown that distilled water is just as good as double distilled water. So you don't really need to have double distilled water, but just simply distilled water. Obviously the water purifiers that I showed that use the PEM system are using tap water, but again, that's very low concentrations. That would be maybe 2 parts per million at the most.
Okay. And then our last question, because I need to leave time for concluding remarks, is treatment with ozone reimbursable? In any case, are there ozone-specific procedure codes?
Well, once again, not specific to ozone. You can probably use some desensitization codes. You can probably use some medicinal codes being placed in pockets and that type of thing. I don't have a knowledge of the specific code that we use, but there are some codes that you can put down there that if you're looking for reimbursement, you can try those types of codes.
All right. Well, thank you. We're going to have to wrap it up with that. And as I'd already mentioned, in a few days, please watch your email for instructions on how to apply to receive your 1.5 hours of PACE-approved CE. I now want to invite you to mark your calendars for Thursday, November 30th, when my very special guest will be Dr. Michael Bobrow, DDS, MBA, JD, whose presentation is titled Anticipating Legal Issues Vital to Dentists, Insights Not Taught in Any School. The successful dentist must either master or have access to those with the skill and experience to navigate potentially treacherous legal and practice management waters. This presentation shows how to anticipate and avoid the many managerial, legal, and ethical challenges faced by today's dentist. Dr. Michael P. Bobrow is a distinguished and multifaceted professional whose career spans nearly 4 decades across dentistry, business administration, and law. And if the name sounds familiar, it's because Michael is my younger brother. As an attendee, you will anticipate legal issues vital to practice prosperity, avoid pitfalls related to hiring and retaining peak performers, choose the correct estate planning structure, confirm HIPAA adherence, and ensure your website is ADA, that is the other ADA, compliant. It all happens on Thursday, November 30th, so be sure to save the date. Until then, this is Danny Bobrow, thanking all of you for your commitment to practice perfection. Goodbye, everybody.
Thanks, Danny.
Goodbye.